on Medicaid and the SCHIP program. But then by the year 2020, we'll once again have 25,000 uninsured. 24 million uninsured. Healthcare reform means that we're going to have some change in health insurance. To a degree, there will be guaranteed issue. They can't get rid of you if you get sick. To a degree, we'll have community rating. Pre-existing conditions are going to be thrown out. Insurance companies will be required to limit their overhead. That seems like a terribly significant thing. But the concern is, does that mean they're just going to pass on increased costs to the consumer? And then we're going to have state exchanges. The good things in healthcare reform are that there will be an emphasis on primary care. We're going to pay more attention to outcome and gradually transition to evidence-based medicine. Quality will be rewarded. Hooray! The amazing thing about quality is the largest single cost saver in healthcare. Prevention, value-based pay, coordinated care, and electronic medical records. Wow, high time. I don't need to preach to the choir about why primary care is so crucial, but primary care means lower mortality rates from cancer, heart disease, and stroke, a 3% decrease in infant mortality, and a dramatic decrease in hospital admissions and costs. Now, this isn't going to be a problem to get doctors to change, is it? I love John Windberg's rules about what it takes to get doctors to change. There are 5 stages. The first stage is, no, the data is wrong. The second stage is, okay, the data's right, but there's no problem because of this. The third stage is, well, there is a problem, but it's not my problem. The fourth stage is, well, it is my problem, but there isn't anything I can do about it. And then finally, yes, I must do something. So, this is what we need. Reinhold Niebuhr's Serenity Prayer. God, grant me the serenity to accept the things I cannot change and the courage to change the things I can and the wisdom to know the difference. Okay, let's get ready for change. The triple aim comes from the Institute in Healthcare Improvement. We need to pay attention to this, folks. Don Berwick is going to be the next director of CMS. Don Berwick really does know about quality. He really does know how to save money. So, we're going to have to learn how to improve the individual experience of care. We're going to have to improve the health of the population that we're looking after, and we've got to reduce the per capita cost of care. And we have to start providing the right treatment for the right patient at the right time. Lots of new organizations in this healthcare reform, the most important of which will be the Independent Health Advisory Board. This is MedPAC on steroids. This Independent Health Advisory Board is going to have so much authority for Medicare, you can't believe it. Peter Orszag, the Office of Budget and Management, says this is the most significant thing in the healthcare reform bill. 19 people We gotta have the right 19. There'll be a commission on key national indicators. There will be a patient-centered outcomes research institute, and of course you know all about the state healthcare exchanges, and actually the National Health Service Corps isn't a new one, but it's a beefed up organization. What isn't included in this? Where are the death panels that Governor Palin was talking about? There isn't any question when it comes to end-of-life treatment, we need to make changes. Have you thought about talking about this in your church? We had a great session this afternoon with Wes Ely from Vanderbilt. We spend, Medicare spends a third of their budget on the last 6 months of life. 29% of the people in the United States have a living will. Of that 29% who have a living will, 60% never share it with their doctor or the hospital. 40% of all patients admitted to an acute care hospital have cognitive impairment. When asked what to do with someone who has had a hemorrhage into their brain, if they're able to answer you, 80% of them say, do whatever the family says. Has your family talked about this? And then I think the most shocking statistic of all about end-of-life care is the fact that when all hope is lost and there's nothing more that can be done, Christians demand so much more care than non-Christians. 3 times as many ventilators, 3 times as many admissions to the intensive care unit. Excuse me? Don't we believe that there's a better place? Start talking about this with your relatives. We need to decrease variation in how we treat patients. We need more effective and efficient markets, better data, easier shopping, and we need to fix pending big shortages in our workforces. The goals of healthcare reform include the development of a national strategy on health improvement. The Secretary of HHS is charged with doing this. We need to establish a framework for global Medicare budgeting. We need MD performance data. We're going to have healthcare innovation zones. There'll be a big change in how we get reimbursed for care. Bundling, and they're going to spend a lot of money to eliminate fraud and abuse. There's going to be a lot of opportunities out there for money. Lots of grants for the state exchanges, grants for doing wellness and prevention and public health, grants to improve the workforce, particularly in primary care. grants in demonstrating quality of care.